Can we really code our way to a healthier society? Well, today we're taking a deep dive into something pretty fascinating from the world of health and medicine, Z codes.
hmm
These are a relatively new attempt to formally document how things like your housing, maybe your job, or even your education level profoundly influence your health.
Yeah,
Our mission today is to explore both the huge promises and maybe some of the surprising pitfalls of this whole approach.
exactly. And Z codes, think of them basically as diagnostic notes, but specifically for non-medical issues.
Okay.
They were introduced to the U.S. back in 2016, but they're used internationally too.
Right.
And they allow doctors, clinicians to formally record these social factors.
Like what kind of factors?
Things like illiteracy, unemployment, poverty, maybe housing insecurity,
Yeah.
stuff that clearly impacts a patient's health.
Right.
It's really a big move towards acknowledging what we often call the social determinants of health.
Those everyday conditions, right? Where you live, work.
Exactly. All those things that shape your well-being, often way more than people realize.
So that immediate legitimacy you get from a code, that sounds, well, powerful. Beyond just, recognition, what are the tangible benefits these codes might offer for you, the patient?
Well, imagine someone struggling with a chronic illness, but maybe the root cause, or a big part of it, is really unstable housing or not having a steady job.
Okay.
For that patient, getting a Z code means their social struggles are finally seen as, well, medically relevant. It's validation.
It validates their experience, right? Moves beyond just treating the symptoms.
Precisely. And that institutional recognition, it can actually open doors for crucial resources. Think about it. If unemployment is formally documented,
Ah, okay.
it could potentially unlock things like legal aid or job support, almost like a medical diagnosis gives you access to specific treatments. That's kind of the civil rights potential some people see here.
So legitimizing the lived reality and potentially connecting people to actual help. You also mentioned earlier it pushes for something called structural competency. How does that change a doctor's approach?
It's potentially a huge shift in mindset. It sort of formalizes this newer medical knowledge, training clinicians to look beyond just the biological symptoms.
Of seeing the bigger picture.
Exactly. They start to understand how societal structures, things like poverty, discrimination, lack of opportunity, how those things directly impact a person's health. That's structural competency.
Yeah.
It means trying to diagnose the social issues contributing to the health problem, especially in situations of what we might call social uncertainty. Those times when it's pretty clear the health issue stems from the patient's environment.
Okay, so medicine starts taking, or at least acknowledging some responsibility for these non-clinical issues. It fits with that broader WHO definition of health, doesn't it?
It does. And it can encourage things like social prescribing, linking patients up with vital community services.
We even hear about hospitals getting praised for, like, proactive stuff, setting up food banks or helping with housing.
Yes, those initiatives are often linked to recognizing these social needs more formally.
But, I mean, it almost sounds a bit too neat. What happens when we start medicalizing these really deep, complex social problems? Are there, unintended consequences?
And that's where it gets really interesting and frankly quite thought-provoking. The article we looked at points to some pretty significant concerns.
Okay.
Like, does documenting these social factors on a medical chart accidentally, sort of, reduce huge societal problems like widespread poverty or systemic inequality down to just an individual patient's diagnosis?
That's a critical point. This whole diagnostic shift, it risks what's called over-medicalization, doesn't it?
It certainly does.
Where these deeply social issues somehow become framed primarily as individual medical problems.
And that can lead to social reductionism, basically boiling down complex societal failings to individual health outcomes, even when they have these deep structural roots.
And think about it from the clinician's side, too. If a doctor codes someone for, say, homelessness, but they can't actually treat homelessness in the clinic,
Right.
doesn't that potentially undermine medicine's own legitimacy? If you can diagnose but not really treat?
Exactly. That's a major tension. If clinicians can diagnose these social ills but lack the direct means to treat them, the burden of solving societal problems can subtly shift.
Away from, say, policymakers and onto the healthcare system.
Precisely. That's what some call lifestyle drift or citizen shift. instead of really tackling the systemic causes like the lack of affordable housing or job insecurity,
We might just end up expecting doctors and hospitals to manage the fallout.
which, they're often not equipped to do alone, nor perhaps should they be solely responsible.
So what does this all mean for you listening? Z codes clearly aren't a simple, good or bad solution. They feel more like a fascinating window into a much larger challenge for both healthcare and society itself.
Absolutely. And if we connect this to the bigger picture, the article really drives home this idea that diagnoses themselves can almost be seen as symptoms of systems.
Symptoms of systems. How so?
Well, their effectiveness, whether they work well or not, doesn't just depend on the code itself. It depends heavily on the values, the priorities, and maybe the limitations of the entire healthcare and social system they operate within.
So, in a system like the US, for example, which traditionally emphasizes individual responsibility,
Right, a system perhaps less focused on collective well-being or structural solutions might struggle to make the most of these codes, or might even misuse them in ways that reinforce individual blame.
this deep dive, it really makes you wonder, doesn't it? Can something as seemingly clinical as a diagnostic code ever become more than just a reflection of society as it currently is?
Yeah, that's the big question.
Could it be aspirational? Could it actually become a catalyst, maybe, for shaping society towards what it ought to be? Something that sparks real social action far beyond the clinic walls?
A powerful thought.
Definitely something to ponder as you go about your day.